So tonight we are talking about homeopathic remedies for families or homeopathic remedies for households. This is going to be part one. There are over 3,000 remedies, so we're certainly not talking about that many tonight. I actually didn't count. I think we might be talking about 21 remedies tonight. Um, these are the group of remedies that I think are the most useful, but it is for a wide variety of issues. So one note here is that it'll be nice for you to watch me in side-by-side view so that none of the screen is blocked by my face. And also put your email in the chat. I'm doing part two, which is remedies M through Z, and that's going to be on April 26th in 4 weeks. So that'll be homeopathic remedies part two. I think I'll probably just send you an email for that, so you're sort of automatically signed up. But if you would like to tell any of your friends about that, or you want to make sure that you're on the list, you can just send me a quick email and let me know you want to come to that. And it'll be a format just like tonight. So this is me. I'm Alexis White, certified classical homeopath. I have a women's healthcare and self-care homeopathy practice. I'm a teacher. I'm a speaker. My practice is in San Anselmo, but for 2 years I've been on Zoom. So I've met lots of people from all over the country who are now my clients. And so even though Zoom is not my favorite, it has opened up a whole new world for me. So I hope to be seeing people soon in person sometime soon in the next couple of months. We always have to wait for the next development and see what happens. So tonight we're going to be talking about remedies. About 4 weeks ago, I gave an introduction to homeopathy webinar. The recording for that can be found on my website. So this is a screenshot of my website. And if you see about homeopathy and then you go down to past webinars and classes, there it is. Right now it's the first video that you'll see because it's the most recent. I'll be posting the video for this class that will supersede the #1 spot, but it'll be right there if you want to go and check that out. In that video, I really talk about the philosophy of homeopathy, how to actually choose remedies, how do you know how many pellets to give, how frequently, how do you know whether you need to change remedies. And so we're going to be really focusing our talk tonight on the remedies themselves and what they're good for, what you're going to think of them for, and not so much about how to practice homeopathy because that's all in this other video. So we're going to start by just very briefly talking about homeopathy, and we're going to start by saying what it isn't. So here's what homeopathy isn't. Homeopathy is not naturopathy. It is not acupuncture. It is not herbal medicine. It's different from all other forms of alternative or complementary medicine. And that's because the homeopathic medicines are prepared in a very special and unique way. They are diluted and succussed, and then the remedy is put onto little pellets, these little sugar globules that you see in the photo there. And this preparation of medicines is what distinguishes it from other modalities of medicine. Of course, it's also different from allopathic medicine, where you just go to the doctor and get an antibiotic. We use different types of medicines for that. So oftentimes people confuse homeopathy with naturopathy. Naturopaths sometimes learn about homeopathy. They may know how to practice it, but it is distinct from all of these other modalities. Here are some very basics about homeopathy. It's energetic medicine. We're giving minute diluted doses of substances. It's gentle. There are no side effects. It's safe for everyone. It's safe for all ages and conditions. It's inexpensive. It's non-toxic. It's green medicine. That means it's sustainable. You can take one substance and make millions and millions of pellets of remedy out of it. So it's very sustainable and good for the earth. It's widely available at health food stores and online. You can get it at Whole Foods. You can order it on Amazon. The books that you need to practice homeopathy at home are inexpensive and really easily available. And homeopathy itself is based on really simple principles that anybody can learn. And that's exactly what I went over in my intro to homeopathy video. So tonight, here we are. We're going to look at remedies, and we're going to be looking at some different facets of these remedies. First, I'm going to tell you what you're going to think of this remedy for. Then you'll note keynote symptoms are going to be in bold, italicized. And then I'm going to have a list of symptoms And then after some remedies, I'm going to have some cases for you, which are real life cases from my practice where I use that remedy so that you can see it in practice and you can kind of see how I pulled out the symptoms that pointed me to that remedy. And I think that this part of it is really useful for people to see, because when you're taking a case, even if it's your own child or your own husband or your own wife, you're going to have a barrage of symptoms and you might not know what to focus on. So these cases really help with that. Okay, so if you did my intro class, you'll know that I did talk about a few remedies in terms of injury and first aid. So we are going to touch on some of these remedies again, and I'm going to expand on them a little bit. So that aconite is one of the remedies that we talked about last time. Now, aconite, you're going to think of aconite for shock, for trauma, and then we talked about that last time. But now we're going to add in the first 24 hours of acute inflammatory illnesses or fevers, and we're going to add in croup. So these are the situations in which you're going to think of aconite. So you'll see the semi-bold italicized symptoms here: mental and emotional shock after a traumatic, fearful, or violent situation. So what does that mean? That means maybe you were in a car accident and you were really shaken up after that, or you had a really freaky thing happen to you. Here's a crazy situation that really happened to me in real life. I went on a trip into the mountains in Montana with my family, and I got swept down a river. And I was with my son, who was about 7 at the time, and I thought we were going to die. And I honestly, I thought, this is it.
Well,
I'm dying.
there's a kit that I think would be good for your backpacking trip.
Hey, would you mind muting yourself? That would be so great. Thank you so much. So I got swept down the river. I thought I was going to die, and it was really hard for me to recover from that. To be honest with you, even now when I think of it, it kind of makes my heart sink a little bit. And I was holding onto my son's hand so hard, I almost took his hand off, and he thought he was going to die too. So we all got aconite. Everybody that got swept down the river got aconite because we had a mental and emotional shock after a very fearful situation. So, but it could be anything. Let's say there's an earthquake, or a tree falls, or there's a gas explosion, and all these things are actual things that have happened in my practice. So it's wonderful for that. It's a fearful, panicky, phobic state. It's for anxiety attacks. And the state that you get into is one of restlessness. You're like pacing around. You can't sit down, you can't settle down. Your mind is all going 100 miles an hour. And then there's this sudden onset of symptoms. So the first part of these symptoms here on this page is really related to the mental emotional shocks. Then we're going to talk about what about these first 24 hours of acute inflammatory illnesses or fevers. So in this situation, what I usually see is something after an exposure to cold or an exposure to wind. So you can see right there, after exposure to cold, dry wind, and then the person is sick right after that. So you might have a sudden onset of illness right after exposure to cold, dry wind, or after fright or shock. So let's say that I got swept down the river and then the next day I developed a fever. So either of these situations would call for aconite. So you're looking at aconite in that first 24 hours after that exposure. And then what you might see is someone is very thirsty. You might see some telltale sign of their face looking flushed, alternating with pale, or maybe one side is pale and one side is flushed. I think looking at a person's face, looking at their tongue, seeing whether they're hot or cold or clammy can be very helpful in picking out a remedy. And then this is going to be your main remedy for the early stages of croup. Now, croup takes into account also a fearful state, because when a child wakes up in the night and feels like they can't breathe, everyone is in a panic. The child is in a panic. The parent is in a panic. You want to get your child to the ER. You feel like everyone's going to die. And so you can see how aconite is really good in that situation. And when you give aconite, then it can just bring that croup right down. So it's the very first remedy that I think of for croup. And if your child has a susceptibility to croup, tends to get croup, I think my kid got croup maybe 40 times. So I feel like a croup expert. You just want to have your aconite on hand, ready to go, sitting on your bedside table. So if your kid gets sick, you just can go right in there and put some pellets right in their mouth. And you can always do it on the way to the ER if you want to. But I think you'll find that the aconite just takes everything down a notch so that then it becomes not so much of an emergency. So here's a case example of one of my clients called me and she said, my daughter is home from college. She's got a bad cold and a cough. Like I picked her up at the airport and she's sick. So I went to bed and then I started to get sick. I felt it in my nose. I've got a stuffy nose. The mucus is just dripping out like water. I can't breathe out of either nostril. She tells me it's worse on the right. I have a headache right between my eyes. She tells me about her fever. All I've done is sleep. I haven't moved from the bed. I ate a little fresh pear and that tasted good. And this is a little clue for later. I'm drinking a lot of water. I've been drinking cold water with ice, but she wants to be bundled up. So she wants ice water, but she wants to be warm. She doesn't have any chills or sweats. She would love some ice cream. I ask her about her mood. She says, my mood is annoyed. My daughter is pretty demanding. She actually texted me from her room to bring her something. Can you believe that? I really prefer to be alone. I don't want to talk or interact. It's too draining. So I ask her, what did you do before? I always ask this question of everyone. Now, if you're in your family, you might already know what happened before, but it's always a good thing to ask, what happened right before you got sick? I did a really, really long run in the rain. It was a downpour. I ran all the way to the top of the mountain. I was out for a couple of hours, and it really did take me a while to warm up when I got home. I was so cold, I couldn't even push the button to unlock the car. So I gave her aconite. And why did I give her aconite? Because A, sudden onset. Her daughter comes home sick. Now she's making this connection between her daughter being sick and then she got sick. Maybe that's the case, but I think probably it had to do with getting cold. But either way, it came on really fast. This didn't develop slowly over several days. It happened, boom, like I went to bed, I felt terrible, and now I'm in bed all day. And so I really based my choice of aconite here on the sudden onset and getting super, super cold and then getting sick. And that's it. I didn't pay any attention to anything else. I thought this is an aconite case. So I give her aconite. I say put 2 to 3 pellets in water, sip it. The next day, she says in the morning, she communicates with me that her fever and her stuffy nose are better. And then in the evening, she says everything else is cleared up. My nasal congestion, my fever, I got some energy to cook dinner. I got a little congestion back with a headache, but it's a little better right now. And she says, I'm heading to bed shortly since I only napped 30 minutes, unlike yesterday where I was in bed all day. So I say, continue with aconite because she's not 100% yet. And this is actually a 2-part case. So we're going to see part 2 in 4 weeks. But this is part 1 where we just dealt with exposure to cold wind. Any questions about aconite? Okay, we're going to move on then to Allium Cipa. So Allium Cipa is made from a red onion. You can see the picture there in the corner. It's, there it is, red onion. And I think you know exactly what it feels like to cut up onions, and you know what that makes your body feel like. It makes you feel like your eyes are watering and stinging and your nose starts running. And so you can see that this is a remedy that we would be thinking for allergies, hay fever, or a cold that has allergy-like symptoms. I mean, you could have a watery, stingy eyes and a runny nose, whether it's allergies or a cold, it doesn't matter. In homeopathy, we don't care about what the name of the illness or disease is. We only care about the symptoms that you're experiencing. So in this case, you're going to Allium Cipa. In an Allium Cipa case, you're going to have a running nose with acrid nasal discharge. What does that mean? That means that when that stuff comes out of your nose, it burns the skin and your skin starts to get kind of red. And you'll often see people with the top of their lip looks kind of red, that margin of the lip, because the nasal discharge is so acrid. And then it's also coming out constantly. It's pouring out, dripping like a faucet, like water. In fact, it's so hard to stop it that people will stuff tissues right up inside their nostrils and have them sticking out, just to kind of plug it up, because you just can only wipe your nose so many times. And you'll find violent sneezing, profuse watery eyes, and then they'll feel better in the open air, unless it's an exposure to flowers and pollen, which will make them feel worse. So you can see that this would be your allergy remedy if this matches the symptoms of your allergies. Okay, next remedy, Antimonium Tartaricum, another great one. This is a remedy, it's a very specific remedy. You're going to think of it for coughs, and a very specific kind of cough. When a person needs Antimonium Tartaricum, they're going to be in a very sick state. They're going to be weak and debilitated. This is a later stage of the illness. Let's say that somebody has had a cough for a while and we just haven't been able to figure out what the remedy is, or maybe they've taken antibiotics, but it hasn't gotten rid of the mucus that's in the lungs. Maybe their fever is down, but they still have really rattly breathing. And so this is not for this initial onset 24-hour aconite type situation. It's the other end of the spectrum, late stages of acute respiratory illness. And what you're going to hear is mucus in the chest, where you can hear it rattling when they breathe in and breathe out. And you probably can hear it rattling. You don't need a stethoscope to hear it. You could just put your ear next to their chest and you'll hear that mucus rattling around. And that cough that they have is going to sound wet, but it's not productive. They're not going to bring mucus up into their mouth that they can spit out in the sink and show you the color like we always want them to do. Show me the color. Is it yellow? Is it green? Is it bloody? Is it brown? Is it clear? No, they won't be able to bring anything up. It's wet, but they're not bringing anything up because that mucus is just stuck in their lungs. And so because of that, they are worse at night, and of course worse lying down. They're going to want to be propped up while they sleep. So these are the key notes of Antimonium Tartaricum. And it's one of those things, we don't use it very often, but when you need it, and it's a beautiful thing. Yes,
Alexa,
question?
The first two were, if you will, plant remedies. We had a flower, we had an onion. What is Antimonium Tartaricum?
Well, it's this beautiful little picture here. It's a mineral. This is a mineral, a tartrate of potassium and antimony. It's a, so we will find this on the periodic table of the elements. So remedies are made from, thank you for bringing that up. We have remedies made from plants, which is most of the remedies. We have remedies made from minerals. We have tons and tons of those as well. And then we have just a few remedies made from animal products, like various little animal products, but mostly we have plants and minerals. So you can imagine that when in the 18th century, when we were using medicines, there were a lot of plant and herbal medicines. And so those medicines got translated into homeopathic remedies. And then sometimes there were some mineral remedies as well. Mercury and arsenic were both considered medicines in that time. And those have been made into remedies as well. Any other questions about that?
Thank you.
Sure. I didn't have a really beautiful picture of Antimonium Tartaricum. I'm sorry about that. Look at this though. So this is one of our animal remedies. This is Apis. It is made from a bee. And we did talk about this in my intro class. We talked about it in terms of the injury aspect of being stung by a bee. So it is the number one thing I would think of if a person was stung by a bee or a wasp. And also for skin symptoms like hives, allergic reactions, poison oak, even sunburn, shingles. And then we're going to add in there today other pathologies like bladder infections and a sore throat. So it doesn't matter what it is as long as it has the symptoms of Apis. And what are the symptoms of Apis? Stinging, burning pain, hot, red, edematous swelling, and that means kind of waterlogged, looking like a little bit like a water balloon. I'm sort of thinking of my throat when I'm pointing at my throat. Aggravated from heat, better from cold. So in the case of a sore throat, you might see a swollen red uvula. The throat itself might be red. The pain of the throat might be stinging and burning. It's going to be better from cold drinks. Whereas, a lot of people, when they have a sore throat, they want to drink hot drinks, but that would make it worse. And then in the case of apis, this pain might extend to their ears. We might see that when they swallow, when they open their mouth wide or stick their tongue out, the pain might extend to their ears. And then you might see it in a bladder infection, again with this stinging, burning, scalding pain upon urination, and there might be some swelling in there and that sensation of stinging. So anytime these symptoms are present, you're going to be able to apply apis to that situation. It doesn't matter what the problem is. It could be a bee sting, it could be an allergic reaction. In fact, this is a remedy I carry in my purse all the time because of allergic reactions. It could be sunburn, it could be bladder infection, sore throat, and then any number of other things that might have this collection of symptoms. In fact, one time I was in Costa Rica with my kids, and my son was very neglectful with his sunburn, and I'm not going to take responsibility for that. He should have known. And I encouraged him, but he didn't do it. And by the end of the day, he was like bright red, like a little beet lying on the bed of the hotel, like, pulsating with heat and redness. And I just didn't have very many remedies with me. I did have apis, and I thought, I'll just give it a try and see if it works. And guess what? It did. I never would have thought of it. And that's why I have sunburn on here, because I've actually used it in sunburn. Or sometimes if you do a facial treatment and you have to peel off part of your skin for some reason, like a cancerous lesion, and you have to use some product that burns it off, you could use apis, because that's going to make you feel red, hot, stinging, burning pain. And that can be really relieving. I have a million stories about apis, but we only have so much time. So we talked about Arnica last time. We'll just touch on it again. Arnica is a remedy for bruising, concussion. It's great post-surgery. Whenever you have surgery, your tissues are getting bruised and pushed around, and there's always going to be swelling and bleeding. It's great for an injury when you sprain, fracture, or bruise yourself with a big contusion. Couple little things I want to add in there. Also, bleeding after dental work. Like if you go get dental work and the bleeding is not stopping, maybe you got your wisdom teeth out, you took your kids to get their wisdom teeth out. Arnica is great for that. It's really bleeding. And that's what bruising is bleeding. It's just under the skin. And then, of course, for labor and postpartum, if there was anything about this, large object coming out of a tiny space, smushing all those tissues, causing a lot of swelling, sometimes some bleeding, Arnica is something that I give to all the moms in my practice who have babies. So the issue is injury to soft tissue with bruising or hematoma. That is the use for Arnica. Sensation is very sore, bruised. And then the telltale sign is when they say, no, I'm fine. I just crashed on my bike and went head over heels down the hill, but don't touch me. I'm fine. I don't need the doctor, even though it's obvious that they're not fine. This is the little keynote mental symptom of Arnica.
Just one,
Okay,
Alexis,
yeah,
one small story. I got a jellyfish sting, and all I had was Arnica gel, and so I used it, and it worked. So homeopathy, you can't do any harm, and
you really can't.
sometimes it's the right remedy. It was amazing. So just a
I
little
think that I totally agree. In fact, one time I got a wasp sting. And somehow this wasp, I was riding my bike and it went right into the vein of my hand. It just hit me right on the vein and my entire arm swelled up. And I used apis, but it didn't help. And I was looking in my books desperately for something to get some help with it. And I ended up using Arnica, and it worked like a charm. So use what you've got on hand, like me with my sunburned kid in Costa Rica, you know, or Lindy with her jellyfish sting. You use what you've got, and sometimes it works. Okay,
Sorry, Alex.
arsenic. Yeah,
Sorry, I have a question as well, if I can, for just the
please.
Arnica. So I'm curious to the so application for labor and postpartum. What would you say? What would the application be? Would it be like a week long postpartum, or?
I might just give 1 or 2 doses right after the delivery is done. And then I might even put a little arnica into some water and let the pellet dissolve, put my finger in it and just wipe it on the baby's mouth too. Because guess what? Baby got squished too. So I
Yeah.
think that it's good for mom, good for baby. And I would just say 1 dose for baby, 1 dose for mom. You could even just give it to mom and then mom's breastfeeding and baby's getting the remedy.
Okay, thanks.
You're welcome. Okay, moving on to arsenicum, such a huge remedy. You can see that these big remedies had to squish it all on one page. This is just has so many applications, but today we're going to talk about it in terms of the gastrointestinal and viral illness aspects. So this is the very first remedy I think of for food poisoning, gastroenteritis, vomiting, diarrhea, stomach cramping. Arsenicum is amazing. Also, any viral illness, especially the flu. It's a wonderful flu remedy. So the keynote symptoms, again, restlessness, fastidiousness. What does that mean? That means I'm cleaning up even though I'm sick. I'm straightening the magazines. I'm making sure the pictures on the wall are straight. I'm fussing about whether the kitchen is clean, even though I'm really sick and I'm telling you about how sick I am and I'm very complaining about how sick I am. I'm still finding the ability to clean up. And there's a lot of anxiety, and that anxiety can translate like, I don't want to be alone. I need your company. I need you to sit with me in the room. I need you to talk to me on the phone. I need you to hang out with me. There's a kind of anxiety about being alone. And then arsenicum is always very chilly. So that means that arsenicum is always going to be worse from anything cold and better from anything warm. So these are like set in stone. This is what arsenicum is. It really is. Maybe your person is not going to be fastidious, but they are going to be chilly. And this is just a very basic absolute about arsenicum. The pain that arsenicum will feel wherever it may be is going to be burning. So that means that if they've got a runny nose, it's going to be burning their skin. If their stomach is hurting, it's a burning pain. If they've got diarrhea, it's going to burn in their bum. If they've got a rash, it's going to be burning. Everything is always burning. And they're going to seem sicker than the illness warrants. So you might think, wow, you don't really seem that sick, but they're going to be pretty complainy about it. And they're going to be thirsty for small sips, of course, of warm water, because everything is better when it's warm for them. They're worse from 12 to 1 a.m. What a weird hour of the day to be worse. But I think it's because you go to bed, you're sick, you go to bed early, and then you might wake up and feel worse at that 12 to 1 a.m. time. They're going to be worse from cold in any form, wet weather, drafts, cold icy drinks. You're never going to see any arsenicum drinking any cold icy drinks. This is what you're really going to think of for food poisoning, vomiting, diarrhea, vomiting and diarrhea simultaneously, which I have treated. And there are only a couple remedies that really come into play when there's simultaneous vomiting and diarrhea. Another one is Veratrum album, if you should ever encounter that problem. And you're going to see this anxiety and restlessness, but then it's going to alternate with kind of an exhausted collapse state. So then like, oh, I have to go to bed. And then a funny little symptom is that they might be thirsty, but if they do drink something cold, they're going to eject it immediately, meaning they're going to vomit it. It's not even going to stay in their stomach. It's just going to come right back out. I use this remedy all the time in the flu, all the time. I do have a case here for you. So this was a long-standing sinus infection and remaining cough with postnasal drip that I got. So the person had been sick for quite a while. She called me and she said, I've been sick for 3 months. I'm very congested. I've got pressure all around my eyes. My mucus is mostly clear, sometimes watery, mostly like egg white. I have a sinus headache that's a constant dull ache. It's better from heat, worse from bending over and talking. I have coughing attacks at night. Starts with a dry tickle and then I just can't stop. It's the worst in the middle of the night. And then a few times I was gagging and almost throwing up. So that's also a very telltale sign when someone is coughing so much that they end up retching, gagging, or throwing up. She's aggravated from cold, aggravated from laughing, super low energy. She's super tired, but she still can't sleep. She's got brain fog with a hard time focusing and concentrating. And I mean, she's so over this. This has been going on for 3 months now. Sinus headache with a lot of pressure right here, maxillary and frontal sinuses. I hear fluid in my ears when I lean down, like a whooshing sound. I've got body aches and chills. My temp is 100.5 and I'm chilly. I noticed I'm doing this on Zoom. She's got her phone, and I noticed that she's constantly getting up and moving around. Like, I see her face, but the background is, constantly moving. She sits in this chair, she moves to that chair. So I say to her, I notice that you're getting up and moving around. Is there a reason for that? Is there, does somebody keep coming in the room? What's going on? And she said, actually, I feel really restless. Even when I'm staying in bed, I'm moving around in the bed and I can't settle down. Then I ask her, does she have any GI symptoms? I think because I'm starting to get the idea here. And she says diarrhea is a chronic issue for her, even before she got sick. And then I ask her a little bit about herself. She says, I'm fairly type A. I tend to be fairly driven and fairly particular. I'm pretty detail oriented. I need things to be tidy. I need for the aesthetic of a room to be satisfying. I have to straighten anything that's crooked on the wall. I have a constant running list of what I need to do and so forth and so on. She says, basically, I manage all my anxieties all the time, or they would just be out of control. And so I give her arsenicum, and we'll look and see, why did I do that? She's worse in the middle of the night. She's gagging and almost throwing up. She's chilly, she's restless, she's got diarrhea as a chronic issue. And then we have just, like the final note that really drives it home. She's driven, she's particular, she's orderly and fastidious, she's anxious, she's an overthinker. So it's the whole picture just looks like arsenicum. And so I give her that. And then I follow up with her a little while later. She says, I'm significantly better. My cough is gone. My energy is better. I have just a little congestion that blows out in the morning and then that's done. She's sleeping well. Brain fog's better. Basically, she's really great. So you can assume that any of these cases that I'm showing to you, everything turned out well. I'm not going to show you cases where it didn't turn out well, although that does happen. Any questions about that so far? Okay, we'll move on to belladonna. So belladonna is a remedy you're going to think of for fevers. For fevers, illnesses, ear and throat infections, and headaches. It's a great migraine remedy. And you might not be treating your own migraines, but maybe you will. Maybe you get migraines and you think, hey, I learned this thing, I'm going to give it a try. It's an amazing migraine remedy, one of the top 3 remedies for migraines. And so what are the main symptoms of belladonna? First, we have this sudden violent onset with a rapid pace. That means that I always think of a child with a fever. So your child is fine at 2 o'clock, and by 4 o'clock, their fever is 104 and they're prostrate on the floor. They went from fine to super sick in 2 hours. That is a sudden violent onset with a rapid pace. They get sick super fast. And that is a really key quality of belladonna, is this sudden onset. Often a very high fever with intense burning heat. So super high, this is like 104 fever usually. It's not these low grade fevers. And the way they look is very characteristic. They have this flushed red face. We called it a tomato face when we were in school learning about this remedy. Like their face is so red, it looks like a tomato. Glassy or bright eyes with dilated pupils. They've got this dry heat without chills, without perspiration, they're not thirsty, they're dry and hot. Now, their body might be absolutely burning hot, like you touch them and you think, oh my gosh, my hand is going to get burned. But then their feet and hands can be icy cold. The pains that they have are going to be throbbing and pulsating. So for example, that's how a belladonna migraine will feel. Throbbing, pulsating pain. That's how the throat will feel. That's how the ear will feel. So you can imagine an ear infection with that pressure behind the eardrum causing this throbbing pain. And they say that belladonna is the calling the pediatrician in the middle of the night screaming with pain remedy for the ear infection because it's so painful. In a fever, a belladonna patient can be confused or delirious. You will look at the tissues, they'll be bright red inside the pharynx, which is the top of the throat, the tonsils, they might be bright red. And they're going to be worse from the slightest touch of anything. So if you try and look in their ear, very upset, touch their throat, turn the head, very upset, swallowing. The tongue may look red or like a strawberry, meaning the taste buds look like they're sticking up a little bit, like the surface of a strawberry. A strange little symptom is that they may desire lemonade or lemons. And then, of course, they're going to be worse from being knocked or jarred. And that means, so let's say it's a headache and they're walking down the stairs and they take a misstep and it jars their head. That's going to be very aggravating for them. Any kind of temperature change, cold draft, noise, for a headache, they're going to want to go into a room, shut the door, turn off the lights, and lie in the dark. And of course, they're going to be better from lying down. So you're going to be thinking of this really for that high fever, usually, and potentially an ear or throat infection. So I have a case. Yeah.
But you have a case too. But as you can imagine, this is a pediatric remedy because we all know our children can go to this place. So I can walk into a room and I can spot belladonna across the room, and I can give them a couple pellets while I'm discussing the case with the mother without ever asking a question. And we can watch before our eyes. The redness drains. The child may either fall asleep or get more energy. Often they just go to sleep. So it's something we can easily recognize and certainly want to have this remedy on hand.
Absolutely, absolutely. There is a kit that has all of these remedies in it, and it's a wonderful thing to have at home because when your kids get sick or people get sick, it's always the middle of the night or 7 p.m. on Friday night, and you don't have anywhere to go to get the remedies. So it's really nice to have a kit with everything in it. So here's my belladonna fever case. So my client called me telling me about her son, who's also my client. He's sick. He came in our bed saying crazy things. He's afraid of the dark. He says there are goblins under the bed. Bad men are coming in. It was like he was awake and asleep at the same time. He cried all night long. He was inconsolable. His lips are crusty. His eyes are glassy. His fever is 102.6. His head hurts. His face is red. No perspiration. I ask about his hands. Turns out they're hot. His feet are normal. Oh, well, so he didn't have the cold hands. Doesn't matter. I did give him Advil about an hour ago. This is really important. This is why I put it in this case, because that means I can now not pay any attention to any of the symptoms for that 4 to 6 hours while the Advil's in his system, because it's going to bring his fever down. It's going to bring his pain down. It's going to change everything. So we just have to wait. We only want the symptoms before he took the Advil. So I say, fine, just tell me about the symptoms before you gave the Advil. And she says his cheeks are really red, but after the Advil, he feels cooler and his head is better, of course. His eyes aren't as glassy, but now, his ears are red. So we know that in about 4 to 6 hours, that Advil is going to wear off and his fever is going to go right back up and we'll be right back where we were. So it was okay for her to do that, but it's not really necessary to give Advil because you can give belladonna instead. And the remedy will the fever will come down, and then it's actually getting to the root of the fever as opposed to just suppressing it for a period of time and then it comes back again. So I asked more about what he said in the night. He kept saying, I'm so scared. Don't leave me. I'm scared of the goblins. There's someone under the bed. Someone's coming in. And then he was kind of delirious. He was weeping and saying that the football was going to come out of the TV at him and he was scared. And she turned the TV off, but he was still scared. It didn't matter. And so you can see that clearly, just these symptoms. He's afraid. His face is red, eyes are glassy, high fever, no perspiration. He's delirious. This kid needs belladonna. So you can see that I pulled out these things. I ignored the part about the Advil, and we give him belladonna, and then I don't have the follow-up, but he was all better after that. And moving on to borax. So borax is, and it's kind of funny to talk about remedies in an alphabetical order because we jump around from one thing to another. It can seem very sudden to jump from belladonna to borax. But borax is a wonderful little remedy with a very specific purpose. It's your remedy for canker sores and thrush. If thrush is an issue that you have maybe with your infant who's nursing and you're passing thrush back and forth, but generally this is the main remedy for canker sores in children. So if your children get canker sores, and for adults as well, any kind of ulcers or aphthay is just a fancy word for canker sore. It can be in the mouth or the nose. I do have clients who get ulcers in their nose. They can be sensitive, very, very painful. They can be bleeding. And then a funny little symptom about borax is the sensitivity to noise and then fear of downward motion. And you might think, what could that be like? And this is like you're carrying your baby, all is well, he's getting really sleepy, and you go to put him down in the crib, and as soon as they feel that downward motion, they wake up and start to cry and freak out and get scared. They can even feel that way when you go down the stairs. And so if you notice that your baby has that kind of sensitivity, it could be that your baby needs a dose or two of borax, just as at kind of a constitutional level to kind of get themselves settled again. So that was something actually that happened with my baby 18 years ago. Okay, Bryonia Alba. Another remedy for influenza and coughs, another really wonderful remedy, so useful. The keynote symptom here of Bryonia is worse from motion, better from lying still. And we're going to come across another remedy later that's better from lying still. But the key here with Bryonia is that they want to lie still because motion makes them feel so bad. So they have aversion to any kind of effort or motion. They're irritable. They don't want to answer your questions. So I always envision myself, or I envision you with your loved one. They're sick. They have the flu. They're lying in bed. They're facing the wall and they won't answer your questions. They just give you like one-word answers or grunt at you. And I think that is what Bryonia looks like. They're really irritable. They don't want to answer your questions. So that is the answer. When they won't answer, that's the answer. And you've got all you need. They're very thirsty. They want to have large gulps of water. They're better from heat. And this is a remedy with a gradual onset as opposed to belladonna and aconite with this rapid, violent onset. This is the slow, gradual onset. So they're going to have a slowly progressing influenza. They're going to have severe aching, and then they're going to not want to move. They're going to want to lie still. They're going to sweat profusely with their fever. And then if they've got a cough, that motion of coughing, like even just the motion that your body makes when you cough, is going to be so aggravating that they're going to want to hold their chest to avoid moving their chest when they cough. So this is a little telltale sign. They're like hunched over, holding their chest to keep it still while they cough. So I've got a case here of a little girl with pneumonia. The mom called me. My daughter had pneumonia or has pneumonia. She tells me she had a 104 fever every night. She got a cough. We went to the doctor. Oh, there's fluid in there. Let's give her antibiotics. So now she's been to the doctor. She's had the antibiotics. The fever is down. But guess what? The cough is getting worse. So what do we do? So she says that cough is aggravated when she breathes deeply. She's not eating much. She just lies in my bed all day. that hurts in her throat and lungs, like something's stuck in there, that mucus is stuck in there. She thought she was going to throw up from the coughing fit, better from lying down, better from being still. Her shoulders go forward and she's hunching when she coughs. She says it hurts to cough. She's aggravated from moving around. She's thirsty. She's chilly. A lot of little details here. She's fine to be alone. So this is really a good question to ask about or observe in your patient, whoever that may be. Do they want company? Do they want to be alone? But this girl, she was really self-sufficient. She didn't need any company. She was fine to be alone. Her eyes are droopy. She's not pale. She's not flushed. You know, I always ask these questions. And that coughing is triggered by her deep breathing. So I give her Bryonia. Why? Because it developed over 4 to 5 days, and now we're even beyond that. It's aggravated when she takes that deep breath and her chest expands, that motion of her rib cage and lungs. She's better from being still. You know, she's worse from moving around. And then she's doing that hunching thing I talked about. She's thirsty. She's fine to be alone. This is enough. So you can see how I just pull out these pieces that really strike me as being characteristic of the case. You know, we didn't see burning pain. We didn't see anxiety. We don't see restlessness. We pull out the things that we see in the case that we think are really important. Next day, she's like a new girl.
For some reason, Bryonia seems to work very well for mastitis. Of course, it's not every
Yeah.
mastitis case, but I'm amazed how often it's as good or better than antibiotics, even red streaks and fevers, and it just works.
There are absolutely so many other uses for these remedies. You know, I mean, I could talk all day just about Arsenicum album or Bryonia, you know, so many uses, and Bryonia is wonderful for mastitis. And so, you know, when we're talking about mastitis, we can talk about lots of different remedies. So don't think that these remedies are limited to what I'm talking about here. They, if you start to get interested, you look at a materia medica, you start reading about these remedies, you'll see, oh my gosh, there's so many other things that these remedies can treat, other symptoms that they have. This is sort of like, not every household is going to deal with mastitis, but every household is going to deal with the flu. So we're, you know, so this is, we can't talk all day. We can only talk a little bit. So, but I'm so glad when you remind me of these things. Thank you. So this little girl, she was like a new girl. She got her appetite back. Her cough was down. She played all day. She was 90% better. And then I might just tell her, take some more Bryonia today a couple times, just until she's 100%, and then you're good to go. So we talked about Calendula last time. This is a wound remedy. I often give it in an ointment form. You can go buy a little tube of it, and I think of it, it's just my homeopathic Neosporin. This is what I put under Band-Aids. This is what I'll put on anything that's like a little scrape or cut or laceration. If you are a person who likes to ride bikes, or you do something where, let's say you fall down and you get a large square footage of your body all scraped up, you can take it pellet form, which is easier than applying ointment to your entire body. So that's another way that I like to give it. Cantharis, we also talked about last time. We talked about it in the context of burns, but I'm also going to add here, it's a wonderful urinary tract infection remedy, and every household needs urinary tract infection remedies right there in their kit, because when they come on, they're terribly painful and irritating and really tenacious. So we have these two uses for Cantharis. Burns, meaning second-degree burns, first-degree burns, even third-degree burns while you're on your way to the hospital. I told a story last time about my son who got a second-degree burn. He was 18 months old, and of course he screamed. And then as soon as he got the Cantharis, and he never cried again during his entire recovery from that burn. And he only had Cantharis and vitamin E on his burn. So I can swear to you that it works. In urinary tract infections, well, in all the symptoms for Cantharis, you're going to see this extreme raw burning pain. You're going to see pain like it's on fire. That's how bad the pain is. It's so great that the person becomes sort of like in a mania-like state. And so what we see in a bladder infection is that there is so much pain with urination that it's they call it voluptuous pain. It's like it's painful and itching at the same time. And then there's this desire to kind of rub the genital area to make it feel better or scratch it. It's like intensely uncomfortable, with extreme pain during urination. And you might see blood in the urine, which is sometimes happens with a bladder infection, and then better from cold applications. So this is just a great remedy to have on hand if bladder infections are something that happens in your family. Causticum, you're going to think of this remedy for coughs, for the flu, and what you're going to look for is this irritated, tickling cough with almost no expectoration. That means no mucus comes up. Like you can feel that there's mucus in there somewhere and they just want to cough deeper and deeper, trying to dislodge that mucus, but you just can't get it out. And there's just, you feel it in there, you want to clear your throat or swallow it, and there's no relief from the sensation of mucus in the throat. And then that burning pain in the chest and throat from the coughing, it's going to feel raw and sore from the coughing. I just had a case of this just 2 days ago. And then worse from lying down, from that mucus, cold air, cold drafts, they're chilly and worse from cold, but better from cold drinks. So this is a little opposite. And then a little funny symptom, craving salty bacon and meats. Now, why would I throw that in there? Maybe your kid is sick, maybe they're coughing, and then they request bacon for breakfast, and it's not something they usually ask for. That's a little telltale sign. It's just nice to know these little characteristic symptoms of a remedy. Chamomilla. This is a remedy that everyone should carry with them on an airplane in case there's a crying baby from their ears hurting. So you're going to think of this remedy on the airplane with the crying baby, also for teething, for colic, and for ear infections. I think of this usually for babies and children. It is the most important remedy for teething in children. It's just the go-to. You got a teething child, let's try it. They are very, very sensitive to pain. And so it's that pain of the tooth coming through the gum, breaking through, the pain of that pressure in the eardrum, the pain of their gas in their tummy. They're just exquisitely sensitive to that pain. It could be from anything. And they don't want anyone to touch their ear, to look in there. They're very irritable and angry, demanding. They cry for something and then they refuse it. That's called being capricious. They want to be carried around. And so you might be carrying them and they're like pointing, and then you see that they are pointing at their toy. You hand them their toy and then they get angry and throw it away. This is called being capricious, and it is the state of chamomilla. They're throwing things. They want to be carried. They're better from being carried. They scream when they're put down. So the mother of the chamomilla baby is exhausted from that demanding nature, needing to be carried around, kind of swiftly carrying around all over the place. They're hot, they're sweaty, thirsty. They can look like they have one cheek red and hot, the other cheek pale and cold. And then in their diaper, you're going to see potentially something that looks like chopped spinach or cut grass, and it might not smell very good, maybe like rotten eggs. And these are all signs that you need chamomilla, and it's going to make your life a lot better. So sometimes there's a crying baby on an airplane. A homeopath friend of mine told me that he took a flight from London to New York with a crying baby, and he finally just went over and put some pellets of chamomilla in that baby's mouth and made the flight better for everyone, and they upgraded him to first class. Okay, cocculus, a wonderful little remedy if you've got people in your family who get motion sickness, car sickness. This is great for motion sickness, for vertigo, and especially for ailments of loss of sleep. Now that means I feel gross when I don't get enough sleep. Like I was sleep deprived, and then the next day I'm just not myself. This often happens when you're night watching. That means someone in your family, maybe your child, maybe whoever it is sick, and you need to kind of be on the alert all night long to make sure they're okay. Maybe you're sleeping in a chair in their room, maybe you're kind of dozing next to them in the bed, maybe you keep waking up in the night from your own bed and coming in their room, and you're not getting a full night's sleep, and then you don't feel well the next day. And this, when there's night watching, it often can go on for days at a time, and then a person can start to feel really terrible. And the symptoms that they might feel would be nausea, motion sickness, vertigo. And then the nausea is going to be like the thought or smell of food makes you feel sick, nausea from coughing, and then worse from the sun, the cold, the open air, and exertion, and then better from lying still. And if you've ever had vertigo, it's just the worst thing ever. So I had one of my clients called me 9:30 in the morning. She said, "Oh my gosh, at dinner last night, the room started spinning. They had gone out to eat. She had some champagne. She thought, maybe I've been drinking too much. I really felt it. Everything is spinning. Even when I'm lying here, the world is spinning. If I open my eyes, things are spinning. It's impossible to function." So I asked her about how has her sleep been, and she laughs, not very good. And she says, my 4-year-old keeps waking up. And so I've been waking up about 5 times a night. He's coming in my bed with me. He wants me to come, like we have negotiations in the middle of the night. So this is kind of a recent development. She had been sleeping really well a few weeks ago, and then something happened for him, a development issue or something, and his sleep got disrupted. So I said, let's give you some calculus. Well, what I've got is 200 right now. I give that to you, and I can give you a 1M if necessary. That's a higher potency. So at 2, so now it's just 9:30 to 2, she says, I'm 50% better. I'm able to actually tolerate the kids. I could go out for a walk on the street, which she could not even do. She couldn't even walk around. Then at 5, she said, I started feeling bad again. So my husband went and got the 1M from you. In about 2 hours, she's 98% better. She feels totally fine. So it's this, just this example is a life-changing situation to go from unable to function due to vertigo to 98% better in just 8 hours. So it just tells you the power of these remedies and these situations that you get into. And this is why I asked her about her sleep, because when vertigo comes on that suddenly, I know that's something I want to rule out at least. And so this was it. She's waking up. She feels like she's spinning. Boom, calculus.
It also helps with animals who vomit in the car.
And kids who vomit in the car. Anyone who vomits in the car. I carry that around with me. I only carry 4 remedies with me all the time, but that is one of them, because you never know, like, we're traveling and we're on a windy road and who knew, and the kids are in the back seat feeling sick, and it's a good remedy to keep on your person. Okay, calculus. This is a remedy for colic, diarrhea, abdominal cramps. It's pretty much a one-trick pony here. You have abdominal pain that's better from bending double or applying pressure. So you're literally like bending over, pressing on your abdomen. You're going to be having acute gastritis with severe, intense cramping pains. Maybe you're restless, extreme cutting neuralgic pains. Maybe it arises after some kind of angry incident or a feeling of humiliation. Again, it's always good to ask what happened just before you got sick or before you started not feeling well. The pains are located around the belly button and then radiating downward to the pubic region. And sometimes pains are followed by diarrhea. But this is pretty much abdominal pain, better from bending over. That is what we're talking about. And I do love this little bitter cucumber. This is a desert plant. I thought this was so cute. It looks like a little melon. Eupatorium perfoliatum, you're really going to be thinking of this for the flu. The main symptom that you're going to be experiencing if you need eupatorium is severe, unbearable aching. It pains so bad, it feels like your bones are breaking, like they're broken. That's how bad your aching is. So sometimes people are sick with the flu and they feel weak, or sometimes they're feverish, or sometimes they're achy, or sometimes they're chilled. And so in this case, you're looking for severe aching, high fever, violent shaking, restless, chilled but wants cold drinks, lack of a sweat with that fever, moaning and groaning. So you're going to think about this severe aching. And actually, I have this ironic case here for you because I myself got sick with the flu one day on the same day I was supposed to give a presentation at Pediatric Alternatives about flu remedies. So I woke up in the morning, my back started feeling achy. I didn't really pay any attention. I was just sitting at my desk and I just started noticing, my back feels achy. Didn't really think anything of it. Felt a little hungry, lightheaded, ate a salad. Soon I started feeling nauseated from that. Then my back got worse. I finally laid down. I thought, oh, what a relief to lie down. I got really chilly. My nausea was getting worse. I was really going downhill. I started getting really achy. I was covering myself up with everything. It was really hard to get comfortable. I just shut my eyes and lay there and didn't move. Only then did it occur to me, maybe I should take a remedy. I am a homeopath. I thought, okay, I'll take gelsemium. This is a remedy we're going to talk about in a minute. But there was no change after I took 2 doses. So I got my kids to bring me my remedy books and I dragged myself to read about these remedies. And I thought, I'm going to look up these 2. Everything just looked like a regular flu, except for the nausea and this lower back that was so achy. And I only saw 2 remedies that had both. And one was Nux vomica, which we'll talk about next time. And the other was eupatorium. And I thought to myself, wow, I know eupatorium is supposed to have this pain like your bones are breaking. Maybe I just have really high pain tolerance, and this is like what it feels like when your back is breaking. So I took eupatorium, and basically due to the aching and the nausea, because everything else was just general, it felt immediately better. I was able to watch TV, which I hadn't been able to do. I still laid there on the sofa, took the remedy about every half hour. The next day, I pretty much was fine, except that I was weak, but all the main symptoms were gone. By day 3, I was 98% fine. So really, I was only sick for about 48 hours. I just had that one bad day, and then the rest was kind of just recovery.
So Alexis, just to reiterate for people who haven't had the experience of getting the similimum, meaning that the remedy that is like cures like, it is often, especially for an acute illness, almost immediate, where you know it's the right remedy. Your whole body relaxes, the symptoms almost go away, not completely, you're still sick, but it is often that quick.
It is, and we often say this in these classes, Lindy, that sometimes you take a remedy and you fall asleep. And that's a really good sign that you've hit the right remedy too, because then your body's like, and then you go to sleep and you wake up and you feel a lot better. And so you can see.
It just illustrates the energetic nature of dis-ease. It's an energetic state imposed upon a body that is otherwise healthy, and then dis-ease is imposed upon it, so the energetic state can be lifted as quickly as it comes on it.
It is amazing to see that. Yeah, it can just go boom, just like that. So moving on to euphrasia, which is really an eye remedy. So we use euphrasia usually in allergies, but it can be with other eye issues where you have irritation, burning, itching in the eyes. Oftentimes that's because of hay fever or allergies, sensitivity to light. In this situation, we think of Allium Cipa and euphrasia as sort of like opposites of each other, where in euphrasia, you've got bland nasal discharge, acrid, watery eyes, But with Allium Cipa, you've got acrid nasal discharge and bland watery eyes. So they sort of mirror each other with opposite symptoms, even though they both have runny nose and watery eyes. And that is pretty much the main use for euphrasia. Ferrum phosphoricum, commonly known as ferrum phos, iron phosphate, a little picture here of a little pile of iron phosphate. We're going to think of this for conjunctivitis, for a sore throat, for an ear infection, mostly for a fever. The ferrum phos is a remedy that I really use for early stages of a respiratory illness that has a high fever, inflammation, but the symptoms are vague and don't really point to another remedy. You kind of think, I don't really have anything here to work with. It's just a fever, but really nothing else. And that's the moment you know that you need ferrum phos. And they can be flushed or have circles of redness on their cheeks, or alternating pale and redness. So it goes red and then it goes pale, and red and then pale. No restlessness, no agitation, a slow onset. This is just like, I'm not sure what else to give. I've just got a fever here and some inflammation of the affected part, whatever it is, the eye, the throat, the ear, whatever. I'm going to give ferrum phos. This is gelsemium, the remedy that I was mentioning before that I took in the flu case that was not the right remedy. And I knew it wasn't right because I didn't get any better. I didn't feel any better. You're going to think of this remedy for two very different things, flu and anticipatory anxiety. Now, the main symptom of gelsemium, the keynote state, is extreme weakness, weariness, debility, sleepiness. And so this is the response to the illness or to the anticipation that they are having trouble with. So it's really great for stage fright, anticipatory anxiety. It helps that terror before a performance of any kind, before an exam, before a sporting event, before going on stage, before teaching a class, before whatever you need to do. If you're feeling really this sense of dread and anticipation of something that's going to really be difficult for you, gelsemium is really going to help. I often give this to people before surgery when they're feeling anxious and dreading that surgery. They feel very nervous and upset about it. And it's very, very helpful. So in the state of the flu, you're going to have this extreme weakness, weariness. Oh, look, it's written there twice. They need to lie down. They can hardly even sit up. So remember how we talked about Bryonia just wants to lie down all the time? So does gelsemium. But they don't want to lie down because motion aggravates. They want to lie down because they can't get up, because they're too weak to get up. Sometimes they're too weak to even lift their arm up off the bed to point at the tea that they want, or even open their eyes all the way. Their eyes are like at half mast because it's too much effort and too heavy for them to keep their eyelids open. This is a slow onset remedy. Maybe the fever is slow onset over a few days, and they can have this trembling feeling, trembling and shivering, chills up and down the back, especially in a flu, and then the keynote headache, of a headache at the back of the head, at the occiput, that extends over the head to the forehead. I've got a little quick case here of my son who got the flu, came home in the middle of school, which he had never done in his entire life. There were times he was sick and he didn't go to school, but he had never come home in the middle of the day. He had a fever. I know his normal temperature was 97, so it's good to know your kid's normal temperature so that you can compare it to their sick temperature. He had chills with trembling and shivering. He felt cold, which is very unusual for him. He was a very hot person usually. He's tired. He's normally hyperactive. Cold hands. He looked pale, tired, achy. It just looked to me like the flu, so I gave him acetylcoccinum, which is what I would normally give if it was kind of vague, like you have the flu, but there's nothing really characteristic here. 6 hours later, no improvement. All symptoms are exactly the same, except he says, I have a new symptom. I have a headache right here in the back of my head. And I thought, okay, I'm going to give him gelsemium because he points at that occiput, which is that gelsemium headache. And then I look back and I see, aha, he just wanted to lie down, and we can pull out those gelsemium symptoms. He took 2 doses, went to bed, woke up totally fine, went to school. Hypericum, a remedy we talked about last time for injuries to nerve-rich areas, like smashing your finger in the car door, hitting it with a hammer. One time at the gym, I dropped a 25-pound weight right on the end of my finger. I then had to go to work, and I thought, I can't even sit down. I was so agitated and out of my mind. I took some hypericum, and I was able to return to work. Ignatia, a really big remedy, a chronic remedy, something that I give to my clients chronically, but can be used acutely for grief. So we're talking about grief is a normal state. Something happens, your pet dies, a family member dies, a friend, there's a situation of grief. Grief is normal. It doesn't need to be treated. But if someone is stuck in a state of grief, or they are having problems because of that grief, that's ailments because of grief, or they're hysterical, they're sobbing, they're sighing, their body is twitching and spasming, they are having a sensation of a lump in their throat, you can give them Ignatia to help them settle down and process that grief. It's not going to take grief away, but it can make it easier to tolerate. And I've used this many times. Ipecac is a remedy, ipecacuanha. You've probably heard of it because if a child drinks poison, you're going to give them Ipecac, so they throw it up. It makes you throw up when you take it, when you actually ingest the root itself. So you have to think it's really good for nausea, morning sickness, throwing up. There is a very sick quality, persistent nausea with no relief. Nothing makes them feel better. Maybe you've noticed sometimes you feel nauseated, you throw up, you feel better. But in this case, no. You throw up, you don't feel better. You're still just as nauseated. Coughing might lead to vomiting. There's an aversion to food, of course, thirstless. You might have a bloody nose along with this coughing and nausea and vomiting, and then worse from rich foods. So this is one of the many remedies I might give for morning sickness, especially if there's no relief from anything, from any eating, drinking, vomiting even. So it's really good to have on hand for that. And it doesn't matter. It doesn't have to be morning sickness. It could be vomiting for any reason. Jumping right around to another mineral remedy. This is a pretty mineral, potassium bichromate, calibic. This is a very specific remedy for sinusitis. So in this instance, when somebody has a sinus infection and the mucus that is in their sinuses is very, very tenacious, thick, ropey, or stringy, what does that mean? They blow their nose and there's like a string of mucus that comes out. It's attached to the Kleenex over here. And it's like this string, it's not breaking. You can like move it around. It's very tenacious. It's strong and stringy. And this is a classic calibic mucus. They're going to have this pain and pressure at the root of the nose, a frontal headache. There are sinuses up here. There are sinuses down here. So this can often cause a feeling of pressure and headache above the eyes. Their voice will sound nasal. They're chilly. So this really, you're looking for that quality of the mucus, that tenacious, ropey mucus, and really stuck in there. Lachesis, we're coming to the end here. We only have 2 more remedies to go, so stick with me. Lachesis, wonderful, huge remedy. In an acute situation, we're going to think of it for throat issues, sore throat, tonsillitis, any kind of a throat issue. Lachesis is usually left-sided, so that means people will come in and say the left side of their throat or their left tonsil or their left gland is more painful or hurts more on that side. They will often have a lump or constricted sensation in their throat. And so this lump feeling, they'll want to swallow, like they swallow it down. It'll get better momentarily, but then it comes right back. So they often complain of this lump sensation. When they describe their throat pain, when anybody comes to me with throat pain, I always ask, what makes it better or worse? Like, is it better from drinking? Is it worse from drinking? Is it better from eating? Is it worse from eating? What situation makes the pain the worst? And with lachesis, the pain is the worst when they're just empty swallowing, just their own saliva is the worst. They actually feel better when they're swallowing food than swallowing their own saliva, which is paradoxical, and which is why it's important to ask that. Oftentimes that pain radiates to the ears on swallowing. Remember that happened with apis as well. I always have people stick their tongue out and tell me, does that hurt? Because that's often a nice little sign that you can look up to differentiate. They will be averse to being touched on the throat, and they will have an intolerance to tight collars or turtlenecks like this or tight necklaces. In fact, lachesis people in general who need this remedy as a constitutional remedy would never wear a turtleneck like I'm wearing or something tight around their waist. They just have an aversion to that. Their throat pain is going to be better from cold drinks, which is another paradoxical quality like apis. And then I often find that this is really true, this aggravation after sleeping. Usually people feel better after sleeping, but not lachesis. They feel better when they wake, and they feel worse when they wake up, like they slept and got worse. And then they feel terrible in the morning, and then they might get better as the day goes on. They get flushes of heat. This is a great hot flash remedy. And then when you look in their throat with a flashlight, which I have all my moms do, I say, hey, look in the throat with a flashlight, tell me what it looks like. It's going to look darker and more purple versus bright red, like you might see with some other remedies. The tonsils or the throat itself might look that way. And then they're very hot, so they're going to be aggravated by heat.
I get it tomorrow.
Hey, would you mind just muting yourself? And then I'm going to tell you about this little case with my own son. My own son is my nice little case studies here. Here was a day that he had a fever. He was weak. He's cold. You already know he's usually really hot. So this was unusual for him to be cold. He said, my throat feels tight. I didn't really know what that meant. There were no other distinguishing features about his illness. I had no idea. He said nothing, except that I saw his crash tag on the table in the living room. And his crash tag is like a necklace that comes down to here, and then it has like what looks like a dog tag on it. It's something that cyclists wear in case they crash, and then people can look up their medical information. And I say, why is your crash tag on the table? And he says, because it's too tight and it makes my throat feel like I'm being strangled, even though it was hanging way down here. Now, this was the only symptom that I had. It was very unusual because he wears that crash tag every single day. He loves that thing. He never takes it off ever. So the fact that he took it off, I thought, okay, this is it. So I gave him lachesis because of this feeling of being tight and strangled. And then he was 100% better the next day. So the tightness is what led me to that. Oh, I lied. We have 2 more remedies now. So Ledum, we talked about last time. This is a remedy that we use for puncture wounds of any kind. It can be an animal bite, insect sting, vaccination, where there's a problem after that. It's a very specific remedy for a tick bite. I always give Ledum after a tick bite. And then our last remedy we're going to talk about is Lycopodium. This is another very broad remedy. How you're going to use it would be really some kind of inflammation, a sinus infection, sore throat, stomach ache, bladder issues, ear infection. And you're often going to see some kind of gastrointestinal disturbance with the other complaints. So they can be bloated and gassy. along with their other complaints. Their manner is very dictatorial and irritable. They don't want to be alone. They want you to stay with them. They're very chilly. They get worse at what we call liver time. This is kind of a liver remedy at 4 to 8 p.m. in that late afternoon time. They're cold, they're chilly, they're worse from cold, better from warm drinks and food, craving for sweets and warm drinks. And then their affinity, let's say their sore throat might be on the right side, more of an affinity on the right side versus lachesis on the left side. So if you wanted to, so we've gone through half the list now. I based my original list on a kit that's available at Hahnemann Labs, and they carry it at Pediatric Alternatives. It's got 35 remedies in it. So the handout that I sent you has all the remedies in the kit on it with everything, all the symptoms and what you'd use it for. And then it's really useful to have a book or 2 or 3 at home so that you can look up the symptoms. You're taking your case, you're looking up the symptoms, you got to have a book to look it up. So you got to have the remedies to give and the book to know which remedies to give. So you need both of those tools in order to practice homeopathy at home with your family. I also have a practical guide that I wrote that's more about the philosophy of homeopathy, dosing and potency, how to know when to give a new remedy versus waiting, and that's available on my website. If you sign up for my newsletter, it's a free download, or I can send it to you. These are the 3 books, not the 3. These are 3 books I really like. There are lots of books out there. Even at Pediatric Alternatives, they carry, I know they carry Miranda Castro and Everybody's Guide to Homeopathic Remedies. These are just 3 that I particularly like. I especially like Everybody's Guide to Homeopathic Remedies.
Yes, she's saying Pediatric Alternatives, right?
And then this is me. So I can now stop sharing my screen, and I am so happy that you guys have stayed with me for this long. Thank you very much for staying. And I'm wondering if anybody has any questions.
There was a question about teething in the chat room and whether
Okay.
Arnica could be used for teething. Just last week, one of the young women who works at the office, Olivia, she wouldn't mind me telling this story, her wisdom teeth were starting to pop through and she was in a lot of discomfort. And I gave her 1 dose of Arnica 30C. And by the end of the day, and it had been bothering her for several weeks, actually, she couldn't believe how much better she felt. So yes.
You never know, and there isn't just one remedy for one thing. You can use lots of things for teething. So when I say that there's, we think of chamomile as the first remedy, that would be, it's very common to use chamomile, but it doesn't mean that other remedies won't work, or in that situation that a different remedy might not be better. It's good to have a place to begin and then know that you can open up your book and see, aha, there are 3 or 4 more remedies that are great for teething. Same with poison oak. We might start with Rhus tox, but then we might open our book and say, Rhus tox isn't working, we'll try something else. Any other questions, you guys?
I have a,
Oh, sorry.
oh, sorry. Go
Go
ahead.
ahead, Susan.
Oh, I actually just wanted to thank you so much for doing this because I now have a almost 13-year-old who is Dr. Woodard's patient for many, many years. And she, I have to say that I have seen homeopathy work like magic over and over and over and over and over in so many instances. I cannot even thank you guys enough for that, because it's like to not have to give like Advil or something, or like drugs. I mean, it was so much that it's like, it couldn't have possibly covered everything. And the homeopathy works so well that it's just like absolutely amazing. So thank you so much and Dr. Woodard for, spreading the word and educating.
You're so welcome. And it's my mission for parents to feel empowered to use homeopathy, just like you're saying, that you have we always have the doctor, we always have urgent care, and we always have the ER, but it's really nice to have something that you can try at home that's safe and easy to use, or at least it becomes easy to use after you learn how to do it, and that you can feel confident that, wow, you didn't have to go to the doctor or the urgent care or the ER. So
Yeah,
we're very appreciative of you
it's
as well.
yeah, very amazing. Thank you.
You're very
I,
welcome.
I just wanted to say one more thing. When I first started homeopathy and all these remedies were coming at me and all these names that I'd never heard before, and worse cold or better heat or this or that, or it's like, oh my God. So one of my teachers explained it this way: when you meet a new person, you hopefully caught their name and maybe that they have brown hair and sort of an energetic about them, but it takes a while until you get to know who they really are. So you just keep reading. Your kid wakes up in the middle of the night with a fever and you read all the fever remedies and you start realizing, pulsatilla, which we haven't talked about yet, is weepy and clingy, and belladonna is hot and red and twitchy. And you just start sorting in a way where you start getting to know them like you would a new friend. So anyone who's listening that might feel frustrated, just hang in there. You can't do any harm. And when you do get the right remedy, like Alexis said, it's like magic. So we can feel very safe in just using these remedies willy-nilly. I mean, at least initially, and then we get more masterful at it. But Alexis and I don't get it the first time, and sometimes not the second time. But
For sure not. There are plenty of cases I could show you where I didn't get the right remedy at all, but it's nice to know the cases where it did work so that you can see how someone is thinking, and that you can aspire to that. You can aspire to, be able to figure it out yourself too.
And thank you so much, Alexis. These are amazing lectures. I'm so glad we're capturing them. They'll, of course,
Thank you.
on your sites, and they'll be on the Pediatric Alternatives website also.
Absolutely. I'm going to send everybody the recording, and all the people who RSVP'd who couldn't make it, they will get the recording as well. You're very welcome.
Thank you
And I'm
very much.
happy to answer any other questions if anybody has any. And if you need to go, please do. I'd love to have everybody's email in the chat so that I can communicate with you later. If there are a couple people whose names don't look familiar to me, so I'd love to hear that. And I'm here if you have any questions.
I do have a question, Alexis.
Yeah.
So I know in your 101, the webinar that you did a few weeks ago, that I believe you said that in most cases you wait for the symptoms before you give the remedy. I don't know if that's correct, but that's what I kind of remember from last time what you said. And you mentioned, I think it's cocculus, you said that's a remedy that's good for like motion sickness or car sick. My son gets car sick just about every time we watch West Marin.
Oh, I think I know where you're going with this.
So I was just wondering, can I just put it in a bottle of water and he can just drink it along the way, or should I wait for him to start to not feel well?
Yes, that's a great question, because when you know your child gets sick every single time you drive to West Marin, yeah, give it ahead of time. That's what I would do. And you could just say, we're getting in the car, in 5 minutes we're going to be on the panoramic highway or whatever it is. So just take it now, and you are basically holding it off.
Okay.
So I would say that's true. In most cases, we don't know what remedy to give until the symptoms appear. In the case of every time we drive to West Marin, we know what symptoms are going to appear. Why allow any suffering to happen at all if we can avoid it entirely?
Perfect. Thanks.
You're welcome. Anybody else have any questions? Well, it's been so lovely having you join us here. Thank you very much for staying. And please join me in 4 weeks when I go over the rest of the remedies. We're going to start with Mercurius and go on from there with lots of other fun stuff. I know I had so many cases. Seems like all my cases were in the A through L category. I'm going to have to pull out some new cases for next time. So I really look forward to seeing you then and at future webinars. So take care, you guys. Have a great evening.
Thanks, Alexis.
You're
Thanks so
very
much.
welcome.